Hello, everybody. This is Michelle, and I am doing my review for week 3 assignment 3.2. And the topic I chose was ethical challenges related to the access of healthcare. Um, Again, hello, everyone. I reviewed the issue of Medicaid that is currently and almost constantly up for debate in Congress from a report I reviewed on CNN, which is a current report. Um, Medicaid, as many of us probably know, provides health coverage to eligible low income adults, children, pregnant women, elderly adults, well, seniors, and people with disabilities. Um, Medicaid is issued through the state according to federal requirements, and it is funded jointly by the states and the federal government. So it is a state issued program that provides health insurance coverage in the state you live, and it is funded by the state and federal government. So Medicaid is the only source of coverage for millions of Americans. That means, again, seniors, children, and families who cannot afford private health insurance coverage. So what that means is just try to explain it just a little differently. Medicaid is a state funded or a state issued insurance in many of the states. And that program is available to people who have disabilities, seniors, low income families, children, and also pregnant women. So it's a big issue, and many of us probably have seen this for many years. There's a constant debate about Medicaid. Um, so there's a report that was covered by a Dr. Sanjay Gupta. He is a neurosurgeon and medical reporter for CNN. He also serves as an associate chief of the neurosurgery services at Grady Memorial Hospital in Atlanta, Georgia, and also as an assistant professor of neurosurgery at Emory University School of Medicine. So he is a medical reporter for CNN, and he was the one that covered this story. So just wanted to break it down just a little bit more. What he talked about is during the time that Obama was president, he mandated that the states were required to expand Medicaid, or in other words, if they didn't expand Medicaid or make it available, they would lose funding from the federal government. However, in 2012, the Supreme Court removed the mandate, which allowed the states to make their own decisions about losing federal funds. So that meant that the states, um, that requirement was no longer eligible, and it still put people at risk. So the reason I picked this topic is I currently now just started a new job, and I work for Medicaid, Medicare, and it's a really big issue. A lot of us probably maybe we receive insurance through our jobs, or some of us maybe we have some private insurance, but there are millions of people who use Medicaid. And ethically, most Americans who receive Medicaid are living at a poverty level, which makes it more of an ethical issue than of not having health insurance. And also, this would mean that seniors and children and pregnant women with Medicaid would be at the top of the list who would be affected. So just imagine that, how that is. Pregnant women not be able to access the services that they need for because they're pregnant. They're not able to get the needed services. Seniors not able to get needed services, and that's really serious because some seniors they may be living at some type of senior facility or nursing home. They may be required to have home health care aides or something of that sort. So Medicaid is a very big issue. So I think it brings up the issue of justice, which means the ability to provide services equally without allowing social status and financial status to prevent people from being able to receive the insurance that they need to get services. So I went over just a little bit, but I wanted to just make sure that I was clear about how I see this as an ethical issue because without Medicaid, even some of us, when we do get to the age or when we are seniors, that is something that we all will need to receive. When you're 65, you normally receive Medicaid unless you have some other way of obtaining your own private insurance. So it's a serious issue. It's been up to debate for years, and it's still up for debate. And what will happen is right now, the new administration is making some changes. Um, the president is saying that he may not fund these programs. So that would also be an issue, because if you really take a look at it, and if you're looking at on the state level, or the people or persons who need this type of insurance, what will people do if they don't have insurance? So it is a big issue. I'm sorry I went over. Again, just wanted to make sure that I covered everything. And thanks everyone, and I hope the video was informative as well as helpful, and blessings.